There's a lot of crossover between the squat and the deadlift squat forms as far as where the weight is positioned, the variations, the amount of knee and hip angle, ankle angle that we go into it. So there's a little bit of a blend in between. So depending if someone's having more issues with either a deadlift or a squat, so we can sometimes transition, we can start with one and then transition into the other or vice versa. They go back and forth to see which one helps us a little bit more. So if someone has some issues of more going into the knee and kind of loading a little more anterior chain, I'll sometimes have them start going into more of the bent leg deadlift position. Then from underneath, I'll have them swing more into a traditional dead leg and deadlift more of a squat, and then come out from underneath. So we can go down into this more of a bent leg deadlift. So I've already loaded my posterior chain to emphasize it. Swing down to as much as the knees can handle, and then push back out. We can also keep the weight up top and work into this a little bit too. We can go forward into the motion and slide underneath. So now I have more of a goblet squat position as I go back and forth. So just like a little dip, forward, slide the body underneath the weight, then drive back out. Conversely, if we have someone that if this position just does not seem to hinge very well going into it, we can go down into more of a, let's go into more of like a, or just like a traditional deadlift or just like a low squat type position, and kind of go into a hamstring stretch and drive out the posterior chain. So I can go down to more of a traditional deadlift, more of a squat style, go back into the posterior chain, then drive out of the hip. We have some initial issues with the initiation of the hip flexion at the top. So that's two different ways to kind of blend between kind of a squat or more of a bent leg style, depending on which one works better for us, how we can bridge from one to the other. So this will be dependent on the case, best to consult a clinician to see which one is better for you, depending on whether you're anterior posterior chain dominant or if there's any shear compression issues with the spine if you're working more of a lower back issue.